Hello everyone, we're Animal Crossing and these are our team members. The problem space of our team is how to place patients quickly and efficiently during the epidemic. When the epidemic broke out all over the world, our team found that due to the large number of patients, the bed resources in various regions were in short supply. Information on bed resources, such as the total number of beds in each hospital, the number of remain beds on the day, the predicted number of remain beds, and the remaining days of discharge from our patients have not been integrated. Therefore, the government and the local GP also have a relatively lag in obtaining this information. To a certain extent, it increases the difficulty of quickly and efficiently placing patients. Good information integration can more effectively achieve the rational allocation of resources, which is beneficial to different stakeholders, such as patients, government, GP, and the hospital.
This picture shows patients are on the floors of an overwhelmed span hospital. It can be really dangerous because this can lead to cross-infection. We can say bed resources are really important during the epidemic. Basically speaking, we want to make data of hospitals more transparent. According to the interview and research we did, the data GP could get is limited. GP needs the number of remaining beds in the hospital closest to the patients directly rather than calling a lot of hospitals. With those data, GP could help patients call the ambulance and place patients quickly and efficiently. For government, they could get the number of patients as well as the remaining resources like beds of hospitals in real time, combining those data and make further decisions.
Based on the feedback from the previous interventions, our team will improve this effect in this round. In-depth study of the identified problem and provide data to prove the necessity of solving the problem. Shift the focus to the system design to enhance the relevance of the solution to IT. Do more explorations to analyze the limitations and risks of the project.
The application is aimed to provide a relatively transparent information for different parties. At first, the system will gather the data from hospital and health department. Health department provide the number of new cases within the day. Also, a predictive model based on the case number of past few days will be generated. Hospital will provide occupation data of their bed resource. Also, the remaining days of each occupied normal bed will also be provided in order to predict the available bed resource in the future. After data gathering, GPs will have access to bed resource of all surrounding hospitals. Thus, they have much clearer view of where to arrange the patients. And the government will get a comparison between available bed resource and case number in every district. The comparison shows the patient settling situation from the past to the near future, which facilitating the decision-making on patients transferring or emergency facility construction.
This is what our system prototype looked like. It collects the data provided by the hospital for statistics and display the bed requirement in different areas on the map. The number of beds required is calculated by the number of cases funded minus the number of available beds in the hospital in the area. The color from dark to light indicate the number of beds in the area. Then click on the map can see the list of hospitals in this area and also the current available beds and the total number of beds in the hospital in this area. Each hospital can see the detailed data in its bed usage. By looking at the trend, you can see the trend chart of the number of people who need bed in the area. Then through the analysis and prediction, we can generate the resettlement strategies recommendation. The information can help the government make decisions faster and more effectively.
The risks we have identified have been separated into three aspects. The first one is the training issue. We need to answer a question. Do doctors have the ability to complete the training of the new system in a short period of time, especially for elderly doctors or those who are reluctant to use a new technology? As for the technical issues, for those regional hospitals, do they have the access of good network to run this system? And financially, can every hospital afford such expenses? And after the outbreak, Where should this system be used to cover the cost? The team has achieved some important milestones during the whole process. Some items in the plan have a certain degree of error with the actual progress, and this is because we had modified the original plans from the feedback gained from each session. But the efforts we made help us finalize the proposal. Thank you for watching our presentation and hope you enjoy it.